What's up, world? How y'all doing? How y'all doing? How are y'all doing? Getting started a little bit late today. A little bit late today. Had to make sure I had a couple things going on, so I'm just gonna give it a second, wait for everybody to jump up in here. And we live, baby. Oh wait, what is that? It says we're notifying viewers that you're live. Okay, cool. But I can start doing that on Instagram? Stop it. Oh man. Hey, what's up, everybody? Welcome, welcome, welcome. You already know what the deal is. We're going to be doing NCLEX questions today. We're going to be doing NCLEX questions today because that's how we do. That's how we do. That's how we do. You already know what the deal is. You already know. What's up? What's up, everybody? Hey, if you're new here, welcome. We're doing NCLEX questions today. Let me know who you are, where you're from, where you're at in your nursing journey. Hey, what's about to get on and popping today? I'm gonna start singing some. I might just play some Jason Derulo in the back, since that's what everybody says. That's my doppelganger. So, what's up? What's up? What's up? How are y'all? Hey, we're gonna do these questions, but I wanna get a good amount of people in here before we decide that we want to do that. All right, so hey, make sure you guys like, share, follow. Make sure you guys send it to everybody, like everybody that you could think of that needs help with NCLEX. The season for NCLEX is almost upon us because graduation is going to be happening in December. So hey, it's cool to get a jump on it now to kind of see where you fall and how you feel about questions, so on and so forth. So let me know. Make sure, like I said, make sure you smash that like button. The more likes that you give me, the more questions that you get. That's up to y'all. Be selfish if you want. You know what I'm saying? Nah, just playing. But hey, I'm a big jokester, so we're gonna have a good time. We're gonna have a good time. So like I said, I want to know who you are, where you're from, where you're at in your journey. Smash that like button. Make sure you share and you follow. What did I want? Stopwatch. There we go. There we go. All right, let's see what we got. All right. Oh, we got good 22 people up in here. All right, cool. Hey, hello. How are you? All right, cool. We got a good 37. What's up, user 7? Was it 7-1? How are you? Hey, welcome. Make sure you guys smash that like button. Make sure you guys follow. Hey, I need 10,000 people to follow me so I can be unghetto. I'm just saying. All right. So like I said, hey, my name's Kevin. I go by the Boot Nurse on all social media platforms. Make sure you guys go out there and you guys go check it out. Got all the links in my link tree. So, hey, we got 90 people up in here. Hey, I want to know who you are, where you're from, and where you're at in your nursing journey. But without further ado, because obviously y'all don't want to look at me. Y'all want to look at these questions because y'all are selfish. I'm just playing. But yeah, we'll jump into these questions real quick. All right, here we go. Hey, so if you want me to unghetto myself, I need 10,000 followers. So here we go. Hey, so we're doing NCLEX questions. Shout out to all 130 of y'all. So we're doing NCLEX questions. I don't gatekeep. I got these questions off of nurselabs.com. So if you guys want to go over there and check that out, you guys are more than welcome. Hey, participate. Participation is the key. If you don't give me any answers or if you don't smash no like buttons, you don't get no more questions. I'm just saying. Also, you need to participate because, it's based off of y'all and we go through the questions together. All right. I'm kind of sort of not funny, but whatever. Hey, the more likes and the more gifts that you give or whatever, the more questions that you get, give me all them likes. Don't troll my chat. Don't come into my chat being a fool because if you troll me, I'm going to troll you and then I'm going to ban your ass. Yeah, I'm going to ban that ass. That's what a 600 is. Yes, it's for LPN as well. I guess I should just start plastering that all over the place. Is that it's both for RN and LPNs as well. Spanish is my first language. Give me some tips on the study, please. Reading, honestly, you have to, it's repetition because if Spanish is your first language, repetition of understanding it, understanding how they're asking you in English is honestly one of the biggest points. So like I said, don't troll my chat. Hey, I'm going to be doing a nursing school summit where I'm talking about the new generation NCLEX. And that's hosted by True Learn and Picmonic. That link is in my bio and it is free to sign up. So make sure you guys go over there and check that out. Also in the link, the 7-day NCLEX course is an NCLEX course I created. It's free. I mean, it's not free. I'm sorry. The link is in my bio. It's for $48 right now. All right. And also, if you're looking for one-on-one coaching and stuff like that, you can go to thebootnurse.com and you can check that out as well. All right. So here we go. Woo. What do I think about mental health for What do I think of mental health nursing? I think mental health nursing is great. It's actually like very, very much needed. When are we starting? I'm sorry, I didn't know we were on your time. Yana, is this overall or do you do specific topics? It's overall, just overall. All right. Hey, so here we go. Here's our first question. A 28-year-old male has been found wandering in a confusing pattern. The male is sweaty and pale. Which of the following tests is most likely to be performed first? All right. Is it blood glucose check, CT scan? Is it a blood culture or arterial blood gases? Blood sugar. We got A's. Hey, so shout out to all 200 plus y'all in here rocking with me. Hey, we're doing NCLEX questions. My name is Kevin. Check out the link in my bio for all the Gucci stuff that's over there. So let's see, hypoglycemic symptoms. Okay. Also, if you are an LPN or RN, these are both for RN and LPN. The biggest thing about LPN is that you need to know what you need to do, where your roles and your responsibilities and what you can and cannot accept. Okay. Melissa says A. Rena, do you say RT? I'm a pharmacy tech. Shout out to you. Hey, we got all types of folks up in here. Alyssa says definitely A. All right, cool. I'm gonna give y'all I'll give you about 5 more seconds. Serotonin syndrome. Okay. A blood sugar check. All right, here we go. And the answer is A. Y'all got it right. Shout out to y'all. We want to do a blood sugar check. With a history of diabetes, the first response should be to check blood glucose levels. Also, with these questions, it tells you the specific category that it falls within the NCLEX pie, because there's 8 sections of the NCLEX pie. Reduction of risk potential makes up about 8 to 12%, if I remember right off the top of my head. 8 to 12% of the NCLEX. Brendan said, just passed NCLEX PN. Shout out to you, Brendan. Hey, everybody give Brendan his flowers. Tell him, hey, congratulate him. Let him know. Hey, welcome to the shit show, Brendan. I mean, welcome to being a nurse, bro. Welcome to being a nurse. So shout out to you. Everybody give him some love right now. Less invasive first, of course. MP here. Can't wait to have you all in our field. You're doing amazing. Thank you, Karina, for that awesomeness. All right, so here we go. Question number 2. A mother is inquiring about her child's ability to potty train. Which of the following factors is the most important aspect of potty training? Is it the child's age, the child's ability to understand instructions, the overall mental and physical abilities of the child, or is it frequent attempts with positive reinforcement? We got C's. All right, cool. Appreciate everybody liking and sharing. Hey, make sure you guys follow. I need all the follows. I need 10,000 people to like me, or at least pretend to like me. Hey, just passed my NCLEX. Hey, shout out to you, Stephanie. Hey, so we got 2 people that passed their NCLEX. So shout out to you. Everybody give Stephanie some love. Tell her welcome to the nursing shit show, or just nursing in general, because it's great, whatever. So congratulations to you. Not me saying B and everyone else is saying C. It's time for me to go. Ma'am, you just got here. What you mean? I'm going to give y'all 10 more seconds. I see C's. We got 1 B. We got a D over here. Okay. Congrats and welcome to, hey, let them know. Savage, let them know. Savage says B. Second guessing myself. Hey, we don't second guess ourselves. We always go with our first instinct. Unless you can 100% tell me why you should change it, don't you ever change it. All right. And the answer is C. The overall mental and physical ability of the child. Age is not the greatest factor in potty training. The overall mental and physical abilities of the child are the most important factors. Okay. So when you guys are studying, it doesn't matter where you guys decide that what product you guys decide that you want to buy or whatever. The biggest thing of retaining the information is remediation. Like, you have to remediate, you have to review your questions. And when you do, read it. Read the rationale of why it's correct, but then read and understand why these answers are incorrect. Okay. It's not D because the question isn't asking that. Yep. It's not. Keyword, most important. Remember, so if I could say one thing to my patient and then leave, or one thing to the parent and leave, that would be, the most beneficial, what would it be? Right? So shout out to y'all. Appreciate all the likes, all the love. Make sure you guys keep smashing it. All right. So here we go. Question number 3. A parent calls the pediatric clinic and is frantic about the bottle of cleaning fluid her child drank for 20 minutes. First of all, wow. Lord of mercy. All right. Which of the following is the most important instruction the nurse can give to the parent? This too shall pass. If any of y'all pick that answer. Oh my God. Take the child immediately to the ER, contact the poison control quickly, or give the child syrup of Epicac. Hey, I'm just saying this too shall pass. Look, I could tell you who's going to pass. It's going to be that child. And I don't mean in a good way. I'm just saying, if you see that question on NCLEX, just know that you might not be doing so well. You might not be doing so well. All right, we got B's, we got C's. I'm gonna give y'all 10 more seconds. All right, got some C's on here. B, the ER can call poison control. Okay. I have a funny story where there was a kid who took an enema, I guess, fluid, and ate and took it, he ingested it instead of it being, in the enema, and they had to call poison control for him. It was hilarious. All right, here we go. The answer is C. Contact Poison Control Center quickly. The Poison Control Center will have the exact plan of action for this child. They don't give Epicac anymore. They don't. Definitely not A. It's definitely not A. All right. So definitely you can call Poison Control first, and then you could take them to the ER. But then Poison Control will be like, nah, you may not need to take them, so on and so forth. Poison Control is on all chemical everything. It's okay. So here's the thing. It's okay if you're wrong. Trust and believe me. It is okay if you are wrong. But this is why remediation is very, very important. But I passed my NCLEX PN, but I'm now preparing. Please give me some advice. Hey, the advice is that you need to know your role. You need to know that what your roles and responsibilities are in regards to being a nurse. You need to know about delegation, pharmacology, what you can and cannot give. Nurse. So the NCLEX is all about nurse safety. So never forget that. A nurse is administering a shot of vitamin K to a 30-day-old infant. Which of the following target areas is the most appropriate? Gluteus maximus, gluteus minimus, vastus lateralis, or vastus medialis. We got C. Thanks. You're welcome. Who said that? I think it was Bill. Was it Bill? Did I say that right? Bilskin. Got C. Okay, C's. Shout out to all 300 and something of y'all. I just saw this on Instagram. How you see this on Instagram? I ain't even connected on Instagram like that, but shout out to Instagram for getting you over here. You know what I'm saying? So I'll give y'all about 5 more seconds. Appreciate the follow, Gigi, Hannah. Thank you. Janelle's. Consider yourself a professional, and this is the career, not a job. Just do this. But okay, got you. Not from another person. All right, here we go. Oh, okay. Here we go. All right. So the answer is C, vastus lateralis. Medications are injected into the bulkiest part of the vastus lateralis thigh muscle, which is the junction of the upper and mid thirds of this muscle. All right. And this came based off of the category of pharmacological and parenteral therapies. Just to let you guys know, pharmacology is the second largest section on the NCLEX, with management of care being number 1 and physiological adaptation being number 3. And if you're taking the PN, it's coordinated care, which is the largest section, which is also management of care. All right. Because obviously as an LP, you need to know what you can't do, what you can't accept. All right. And you need to know what tasks you can do as well. And when you need to give up a patient if they become unstable, because according to NCSBN, you are not allowed to take unstable patients at all. Just saying. All right, here we go. Question number 5. A nurse has just started her rounds delivering medications. A new patient on her rounds is a 4-year-old boy who is nonverbal. This child does not have any identification on what should the nurse do. Contact the provider. Ask the child to write their name on paper. Good luck. Ask a coworker about the identification of the child, or ask the father who is in the room the child's name. Got D's, we got C's. Okay. All right. A or D. Alexis, you got to give me one. There can only be one. There can only be one. Hey, I just want to let y'all know, every 5 questions, we take a break where I do a little recap. All right. I'm just letting y'all know. So there's 700 of y'all up in here right now. I'm pretty sure it's going to go down to 4 because nobody wants to hear me run my mouth about stuff. So y'all better participate. Hey, make sure y'all smash that like button. Keep following. Thank you for the follow. What if it's not the father? Well, if it's not the father, then, that DNA test is Gucci and Maury done did his thing. Let me just say, I'm going to give y'all 10 more seconds. All right, here we go. I say B. Okay, Heather, I got you. All right, here we go. And the answer is D. Ask the father who is in the room the child's name. In this case, you can determine the name of the child by the father's statement. You should not withhold medication from the child after identification. Moesha. Mo to the E to the. Yes, girl, that's what I'm talking about. Oh, okay, that makes sense. Yeah, got it. There you go. Hey, sometimes It says what it says. Definitely don't read into the questions. So definitely don't read into the question on the aspect of trying to like put more information there than needs to be there. You know what I'm saying? Yikes, not me. What? Yikes, not me getting it. And then I don't trust no. Always rely on patients, doctors, something. All right, hold on. All right, how do we know the guy in the room is the father? You got to ask, hey, you the daddy? You the pappy? And they'll probably be like, I'm the pappy. All right. Hey, shout out to y'all. Hey, so we're doing NCLEX questions. Shout out to all 840 y'all that are in here rocking with me. Make sure you guys smash that like button. Make sure that you got me. Yeah, it must be ATI. Make sure you guys like and you follow because those are the things that are most important. Keep participating. Participation is great. That's what makes this whole thing awesome. Also, I'm kind of funny. Maybe. Just depends on the day. Make sure, hey, the more likes and stuff that you give, the more questions that you guys get. Just, hey, it's that simple. Give me all them likes. Don't troll my chat. You troll my chat, I'm gonna troll you, and then I'm gonna give you a 600. Okay? And the 600 is mean I'm just gonna ban you. So you come in here, you act a fool, I'm gonna ban that ass. So don't you be rude up in here, and don't be rude to me, and don't be rude to nobody else. All right? I don't got no co-host in here because I'm just rocking solo right now. I don't gatekeep. I got these questions off nurselabs.com. They got a whole bunch of other not classes, but questions and stuff over there if you guys are interested. So go check them out for yourself. $600? No, a 600 means 10 minutes. And that's how long I'm going to ban you. Come on, read. Lord of mercy. Also, I am going to be doing the Nursing School Summit, which is presented by True Learn and Picmonic. That link is in my bio. It's free to register. So if you guys are interested, you guys can go over there and check it out. There's going to be a whole reading is fundamental. There's going to be a whole bunch of other nurses that are going to be over there dropping some knowledge. I'm specifically talking about the new generation NCLEX. So we're not doing fundamentals. This is just a mixture of questions. Also, I have an NCLEX course if you're interested. That is $48. It's essentially for however long you want to keep it. It's in its pre-launch phase, so we're uploading stuff, every week or every 2 weeks or so. So check that out. Also, if you're interested in coaching, you can check out bootnurse.com. All right, here we go. On to question number 6. Appreciate all 400 y'all rocking. Look, hey, half motherfuckers left. Oh, here we go. Question number 6. A patient is admitted to the hospital with a diagnosis of primary hyperparathyroidism. All right, so paint the picture. Hyperparathyroidism, right? A nurse checking the patient's lab results would expect which of the following changes in laboratory findings? Is it elevated calcium? Is it a low PTH? Is it an elevated serum vitamin D? Or is it a low urine calcium? Got A. Somebody said some B. We got an A. Got a B. Got an A. Meek Mills. All right. We got A. Wifey says C with a question mark. I don't know. Wifey, you tell me. Hey, so remember, don't change your answers, right? Don't change your answers. Usually your first feeling, your first answer is usually your right answer 9 times out of 10. You don't know. Oh, Lord of mercy. All right. Appreciate it. Is it DeBryan says, I can't see what you said. Calcium and, okay, y'all are answering way too fast for me to even catch up. Affects the PTH. Okay. Right. Okay. I'm going to give y'all about 10 more seconds. Got B. Is it Keela says A. High PTH equals high calcium. Okay. C, because I want to be different. Okay. Okay. Guys, it's not B. Okay. Hey, look, they dropping knowledge down there. All right, here we go. So the answer is A, elevated serum calcium. The parathyroid gland regulates the calcium level in the blood. In hyperparathyroidism, the calcium level will be elevated. Elevated calcium. All right. And it says the chronic excessive reabsorption of calcium from bone caused by excessive parathyroid hormone can result in osteopenia. I probably said that wrong, but don't judge me on how I talk. All right. And that category, it came from the category of reduction of risk potential. All right. Just learn this. That's okay. Learning and reading also still fundamental. I had to break it down, but I got it right. And it doesn't matter. As long as you're able to break it down and you're able to understand it for yourself, then that's all that matters. You broke it down. You got the answer right. Gucci. We Gucci out here. All right. There you go. High C equals high PTH, low phosphorus. Look at y'all. Shout out. Learned a lot in labs, right? And all right, here we go. Question number 7. Appreciate all 500 y'all rocking. We're doing NCLEX questions. Make sure you guys smash that like button. Also follow and share. Don't be greedy out here. You know what I'm saying? Share this knowledge. Here we go. Question number 7. A patient with Addison's disease asks a nurse for nutrition and diet advice. Which of the following diet modifications is not recommended? So the key word, what's the key word in this sentence? Got some D's. We got some D's. We want to pay more attention to the modifying phrase than the original noun, right? So the modifying phrase, which will be which of the following diet modifications is not recommended. So what do I not want to recommend? As in, hey, Addison's disease wielding individual, you cannot have this to eat. Low sodium diet. Okay, we got D. I'll give you another 15 seconds. All right, we got A, we got D, we got D. Okay, all right. Hey, if you guys are just joining, welcome. Hey, I want to know where you guys are from, where you guys are at in your nursing journey. You're a brand new nurse. You know, you've been a nurse for a while. How long you been a nurse? You know, let's foster that conversation. Let me know what's up. And the answer is D, a restricted sodium diet, right? A patient with Addison's disease requires normal dietary sodium to prevent excessive fluid loss. Patients should eat an unrestricted diet. Those with primary adrenal insufficiency, also known as Addison's disease, by the way, you'll see both of those terms used on NCLEX, should be ample or should have ample access to salt because of the salt wasting that occurs if their condition is untreated. Infants with primary adrenal insufficiency often need 2 to 4 grams of sodium chloride per day. Add a ton. Look at that. Add a ton. Cass is here. Oh, snap. Okay, girl. 2 terms left. Hey, you almost there. Is it Kyla? You almost there. You almost there. Tampa, Florida. I love Tampa when I was there. I went to go visit a long time ago. I liked it when I was there. All right, here we go. Here we go. Appreciate y'all. Make sure y'all smash the like button. Whatever the kids do nowadays. I don't know. Wait, but like, share, follow. All in there. Make sure y'all smash it. All right, here we go. Question number 8. It says, I'm in my last semester. First term. Hey, we got a whole bunch of folks up in here. All right, question number 8. A patient with a history of diabetes mellitus is on the second post-operative day following a cholecystectomy. She has complained of nausea and isn't able to eat solid foods. The nurse enters the room to find the patient confused and shaky. All right, so there's one of those things that we're talking about, a level of consciousness, right? Which of the following is the most likely explanation of the patient's symptoms? Is it anesthesia reaction, hypoglycemia, hyperglycemia, or diabetic ketoacidosis? We got C. Sarah, you don't got to yell at me, girl. I see you. I see the C. I see it. I see the C, Sarah. Jocelyn says C. Is it cheating that I am a type 1 diabetic? No, I think that that's like me saying you have an unfair advantage because of of an ailment that you have. And it's only, hey, if you ain't cheating, you ain't trying. And I don't even consider it cheating. I consider it, guiding or helping. So help yourself. All right, I'm going to give y'all 10 seconds. All right, we got C's. Choir Boy says C. All right, cool. I see you. User29 says C. All right. C's get degrees. Facts. Don't tell nobody else that. All right. So here we go. Patient has hypoglycemia. A postoperative diabetic patient who is unable to eat is likely to be suffering from hypoglycemia. Confusion and shakiness are common symptoms. Reduction in cerebral glucose availability can manifest as confusion, difficulty with concentration, irritability, hallucinations, focal impairments, and even coma and death. So that's why it's super important that we know our endocrinology, right? We want to know about DKA, hypo and hyperglycemia, right? Was it hyperosmolar, HHA, was it HHNK or hyperosmolar, hyperglycemia, non-ketosis, something wild like that. HHA, HHS, whatever y'all want to call it. HH10K, there you go. There's too many H's. All right, hey, and that's under physiological adaptation, third largest section on NCLEX. All right, here we go. Question number 9. A nurse assigned to the emergency department evaluates a patient who underwent a fiber optic colonoscopy 18 hours previously. So they had a colonoscopy 18 hours ago. The patient reports increased abdominal pain, fever, and chills. Which of the following conditions poses the most immediate concern? Bowel perforation, viral gastroenteritis, is it colon cancer, or diverticulitis? She said, I say A. Okay. What sound does that letter make? Tell me. All right, we got A. Okay. All right. Shout out to y'all. Appreciate all 203 of y'all rocking with me. Hey, if you guys are just now joining, my name's Kevin. I go by the Boot Nurse. I'm going to give y'all about 15 more seconds. We're talking about NCLEX stuff, talking about nursing stuff. So I want to know who you are, where you're from. If you're new here, make sure y'all follow. Don't be greedy, okay? I'd follow you if I would get in questions, okay? Here we go. And the answer is A, bowel perforation. Bowel perforation is the most serious complication of colonoscopies. Important signs including progressive abdominal pain, fever, chills, and tachycardia, which indicate advanced, peritonitis. One of the most serious complications of colonoscopies is endoscopic perforation of the colon, which has been reported as between 0.03 to 0.7%. Although colonoscopy perforation occurs rarely, it can be associated with high mortality and morbidity rates. So hey, they can perforate that bowel with them scopes. They're only so flexible. All right, I'm new. I'm literally answering this with very little nursing knowledge. That's okay, Jocelyn. That's okay if you answer with very little nursing knowledge, because guess what? You're gonna learn something today. You know what I'm saying? That's all I'm saying. Med student, is that Kaylin? Okay, there's been a bunch of med students that have popped in here. I'm waiting for one of them to come in here to tell me easy money because he knows everything. If y'all know, y'all know. I've been a CNA for 16 years. Hey, that's what I'm talking about, Amy. Shout out to you. I got my CNA in high school 5 years ago. Cool. Hey, we can progress out here. Took NCLEX October. I strictly used UWorld and passed the first time. Shout out to you, Savannah. I wish I could say the same because I did not. I used UWorld and I did not pass. It just wasn't for me, and I took it in 2018. Here we go. Question number 10. A patient is admitted to the same-day surgery unit for a liver biopsy. Which of the following lab tests assess coagulation? Select all that apply. Select all that apply. A, B, C. No D. Oh, all. Oops. All of them. Okay. A, B, C. Okay. Kaylin says not D. Okay. ABC. I'm going to give y'all 15 more seconds. Sorry if you guys hear my son in there. He doesn't know how to act. He comes in here, he yells. He acts like he pays rent or mortgage or whatever. He's out of control. Out of control. All right, here we go. Here's answer in 3, 2, and it is A, B, and C. Prothrombin time, partial thromboplastin time, and platelet count are all included in coagulation studies. Definitely be add AC. Okay. Like definitely be at AC. Couldn't just say ABC, huh? You just had to be different. Whatever. You know, you do you. I ain't gonna say nothing. I don't judge nobody. So, hey, we're at another break. Hey, y'all, we've already gone through 10 questions and we only been doing this for less than half an hour. So shout out to y'all. Hey, it's break time. Hey, make sure you guys keep participating. Right? I appreciate the participation. It makes everything goes by so smoothly and I'm able to conversate with y'all, which is what I like. I talk a lot. If you don't like it, then, you know, you can just like not listen to me talk and just go away. Hey, the more likes, the more questions that you guys get, give me all them likes. Hey, once again, don't troll my chat. Don't be that person. All right. Cause if you troll me, I'm gonna ban you. And that's all I'm gonna say. I don't gatekeep. If you guys want to know where I got the questions from, they're from nurselabs.com. They have, if you're a brand new nursing student, they have nursing diagnosis over there. They have all different types of stuff over there for you guys to learn from. So make sure you guys check that out. Make sure you guys like and follow. I need at least 10,000 people to follow me because, you know, be cool and to like me, right? I'll be doing a nursing school summit presented by True Learn and Picmonic. That link is in the bio. It's free to register. Make sure you guys go over there and check that out. 7-day NCLEX course. We're in our pre-launch phase, $48. Once you get it forever. Go over there and check that out. Also, if you're looking for one-on-one coaching, go to bootnurse.com. It's kind of cool over there, but you know, whatever. Go check that out. It says Nurse Labs is your BFF in nurse school. Facts. Waiting for my ATT. Look, hey, it'll come. It'll come here. It'll come before you know it. All right, here we go. Question number 11. A nurse is assessing a clinic patient with a diagnosis of hepatitis A. Which of the following is the most likely route of transmission? Is it sexual contact with an infected partner, contaminated food, blood transfusion, or illegal drug use? B. Sierra says C. Okay. All right. Okay. Kaylin says B. Lindsay says B. Is it five? Is it? I'm gonna butcher that. Michelle says C. Is it Sis says B. B. A. We've got B's. Okay. I'm gonna give y'all 10 more seconds. All right, no idea. That's fine. Give me a guess, JG. Give me a guess. Give me a guess. Give me a nice, educated hypothesis. Appreciate all 130 y'all rocking. Make sure you guys follow. Make sure you guys share. Sharing and the following are the most important. Which you gotta smash that like button. Smash it. Hey, I'm waiting for JG to give me an answer. Come on, JG, give me an answer. I need an answer. Honey says A. Okay. You can get Hep A from an apple. Damn right you can. It's disgusting. All right. Well, I guess JG don't want to answer. I think I put JG on the spot. So here we go. Here's our answer in 3, 2, and the answer is B. Contaminated food. Hepatitis A is the only type that is transmitted by the fecal oral route through contaminated food. Hep A is a single-strand positive sense linear RNA enterovirus of the whatever that is family. I'm not going to say it. In humans, viral replication depends on hepatocyte uptake and synthesis, and assembly occurs exclusively in the liver cells. So I'm just like, a really good way to remember this is hepatitis A. I think of hepatitis anus because that's where you get, fecal matter from. Somebody said, I remember Hep A as an apple. Look, I ain't eating no dookie apple around here. Okay. It's gross. So hepatitis A, hepatitis anus, because that's where fecal matter comes from. Right. So if you see this pop up, you're gonna be like, okay, it comes from fecal matter, ends up on food. I ingest it. Now I'm sicky. Right. But who is that? Boy Mom. I like that one too. So hepatitis B, you got blood and bodily fluids. That's the way that I remember that one too. All right. So here we go. Shout out to y'all for answering this question. Hey, if you're new here, we're doing NCLEX questions, nursing style type of questions. These are off nurselabs.org or, oh my God, nurselabs.com. So if you guys want to go check those questions out for yourself, hey, go check them out for yourself. All right, here we go. Question number 12. A leukemia patient has a relative who wants to donate blood for transfusion. Which of the following donor medical conditions would prevent this? A history of hepatitis C 5 years previously, cholecystitis requiring cholecystectomy 1 year previously, asymptomatic diverticulosis, or Crohn's disease in remission. You're going to guess A. Hey, y'all hear him? Can y'all hear him? I laugh every time he screams because he doesn't scream like this until I start streaming. Every single time. Cass says A. Oh, well, A. All right, guys. Cass done already answered, y'all. I don't need nothing else from y'all. I'm going to give y'all 15 seconds, though, but Cass already done gave me the answer. He's a terrorist. I probably shouldn't say that on TikTok. I don't need people, get mad at me and be like, oh, my God, why you say that about your son? He's beautiful. He does got a good set of lungs. He cries. He cried the whole way home, let me tell you. Here we go. All right, here's our answer. In 3, 2. Our answer is A, a history of Hep C 5 years previously. Hep C is a viral infection transmitted through bodily fluids such as blood, causing inflammation of the liver. Patients with Hep C do not donate blood for transfusion due to the high risk of infection in the recipient. And so we ain't trying to give nobody a blood transfusion if I got icky bloods. I'm just saying. Got it? It's kind of like Cardi B. These is blood issues or bloody. All right, I'm done. On to the next one. Here we go. Shout out to y'all rocking with me. Make sure y'all y'all smash that like button. Y'all share. Loving it. Here we go. Question number 13. A physician who diagnosed acute gastritis a physician has diagnosed acute gastritis in a clinic patient. Which of the following medications would be contraindicated for this patient? So which medication do I not want to give to this patient? So here's another thing is if you don't understand what the question is, reword it into layman's terms for you to better understand it. Okay. And don't reword it to the point to where you reword the whole sentence. You'll get the whole question wrong. So don't do that to yourself. All right. All right, here we go. So we got D's, we got A's. I saw somebody else put an A up in here. Yeah, A, we got D. Appreciate the share. We got D. Okay, D. All right. D. All right. Got D. JG says D with a Kaylin says A. Okay. All right. The med student? I'm just playing. I'm just messing with you. All right, I'm going to give y'all about 10 more seconds. Give me some answers. What you got? Kirsten says A. Wifey says D. What up? I cannot with this guy. Got A. All right, here we go. Here's our answer in 3, 2. The answer is A. Naproxen sodium is a non-steroidal anti-inflammatory drug that can cause inflammation of the upper the upper GI tract. For this reason, it is contraindicated in a patient with gastritis. Naproxen is used to relieve pain for various conditions such as headache, muscle aches, tendinitis, dental pain, and menstrual cramps. It also reduces pain, swelling, and joint stiffness such as arthritis, bursitis, and gout attacks. NSAID, always take with food. That's right. Because, hey, what happens if you... Contraindication means you must have just got here. Men hate me, but I don't care. Okay, cool. All right. I mean, if you don't care, I don't care, but whatever. Contraindicated means to not give. What's the best way I could put that? Like, contraindicated meaning to not give, like, because it's bad. It'll give you a bad reaction. Not you. Oh, okay, cool. All right, cool. I got you. Against. There you go. Somebody said against. Obviously, I don't got a dictionary in front of me because I just got all this in front of me. So shout out to y'all. All right. It affects the patient in a negative way. Look at that. See, we could all put it in layman's terms, baby. That's what I'm talking about. Here we go. Question number 14. The nurse is conducting nutrition counseling for a patient with cholecystitis. Which of the following information is important to communicate? The patient must maintain a low calorie diet. The patient must maintain a high protein / low carb diet. The patient should limit sweets and sugary drinks. The patient should limit fatty foods. I'm struggling with my HESI entrance exam. Any tips? I would buy that Mometrics HESI book off of Amazon. Also, there's another one. I think it's a Trivium. It's called Trivium. And the HESI Trivium A1, it's by Trivium, but it's the HESI A1 book. That's what I use for HESI. I failed my first HESI. Hey, y'all, I fail all around here. I am unsuccessfully successful, right? Because I failed at so many things. So, hey, for those that don't know, I've been a nurse for 3.5 years. I specifically work in the OR. I have a little over a year of ICU experience. So I have ICU and OR experience. Makes oily stool D. Okay, should I include alien abduction? What? Thanks for the honesty. Look, I ain't got nothing to hide. We use Kaplan. Oh, y'all. Hey, Kaplan is cool. All right, so here's our answer in 3, 2. All right, so the answer is D. We want to limit those fatty foods, right? Cholecystitis, which is the inflammation of the gallbladder, is most commonly caused by the presence of gallstones, which may block bile ducts, essentially from. So essentially, gallstones will block the bile ducts, the bile from entering the intestines. Patients should decrease dietary fat by limiting foods like fatty meats, fried foods, and creamy desserts to avoid irritation of the gallbladder. Listen, I live in Texas. And I'm telling you, it is not. I live in Texas. I specifically live in San Antonio, and it is not out of the ordinary to see teenagers get their gallbladders taken out because we have a very high Hispanic culture here. All right. Like, as a matter of fact, I want to say in San Antonio, it's 70% Hispanic, and Spanish is the primary language here. So I actually did a research paper on diabetes, as well as we were talking about dietary stuff for people that have diabetes. So, what is it? How many questions do you review? I don't know. It just depends on how many likes I get. Right now, I only got 10,000 likes, so I could have stopped at 10, but I ain't selfish like that. I took my NCLEX and you take your NCLEX in 3 weeks. Shout out to UZ. You're gonna be doing Gucci out here. Question number 15: a patient admitted to the hospital with myocardial infarction developed severe pulmonary edema. Which of the following symptoms should the nurse expect? So, what should I see the patient exhibit? Is it slow, deep respirations? Is it stridor, bradycardia, or air hunger? What Cass say? Cass said something slick out here. Cass, you out here being a bully? Oh, okay, cool. All right, cool. 600. So, all right, so we got some A's out here. But yeah, y'all, I am very, very honest. I'm very honest and upfront about like me being unsuccessfully successful. I failed my NCLEX 3 times. Three times. And I ain't got no shame. I got no shame in telling none of y'all that. None whatsoever. All right, I'm going to give y'all about 10 more seconds. All right, cool. Christine says D. Men hate me, but I don't care, says A. I cannot with your name. For what? What do you mean for what? I'm not sure, but I'm going to be B. Okay, Cass, I got you. I failed it 3 times, too, and still ain't passed. It's because my attention span won't let me be great. You might want to do something. It's Daria online. XP? What? Like Daria the show? All right, here's our answer. The answer is D. It's air hunger. Air hunger. How far you took the NCLEX? How long you wait to take it again? 45 days. Wow. I know. Well, it's okay. Hey, look, this is one of the ones that stumped y'all, right? So here we go. Let's read. Hey, look, this is one of the ones that stumped y'all, right? So here we go. Let's read the rationale. Let's read the rationale. Patients with pulmonary edema experience air hunger, anxiety, and agitation. Symptoms may also include coughing up blood or bloody froth, difficulty breathing when lying down, feeling of air hunger or drowning. What else? There's too many parentheses. This feels like was it a paroxysmal nocturnal dyspnea? That's what it's called. Oh my God. If it causes you to wake up 1 to 2 hours after falling asleep and struggling to catch your breath, right? Never heard of air hunger? Hey, first time for everything, Kirsten, right? Am I right? Am I right, y'all? Am I right? So kind of look at her. Okay, I got you. If you lack oxygen, your body will try to compensate by breathing faster, not slower. Your body is compensating by breathing faster for the simple fact of now your heart has to work harder because it's not having the appropriate oxygen exchange in the lungs. So it's your way of essentially your heart palpitating and going faster like that. That's why that does that. What's up, friend? How are you, Taryn? Shout out to all 95 of y'all. All right, so here we go. Hey, we're at a break. I appreciate everybody being here. We're doing NCLEX questions, so I appreciate you guys participating. So keep participating. Smash that like button. Make sure you guys share. Make sure you guys follow. I need all the love. I need all the follows because I need 10,000 people to like me. Okay, so here we go. Make sure you guys participate. Make sure you guys smash the like button. Give me all them likes. Give me all of them. Not some of them. Not a few of them. I want all of them. Don't troll my chat. If you troll my chat, I'm going to ban you. I got these questions off nurselabs.com. Specifically, I got this one from one of the comprehensive exams. You guys can go over there and check that out as well. I will be doing a nursing school summit presented by True Learn and Picmonic. That is free. You can go and register for that. That link is in my bio. It's right up there at the top, so it's free to register. 7-day NCLEX course is in its pre-launch phase. It's for $48. Once you get it, it is yours forever. If you're looking for one-on-one coaching or tutoring or mentoring, you can go over to bootnurse.com and check that out as well. On to the rest of the questions. I appreciate all the follows. Here we go. Question number 16. A nurse caring for several patients in the cardiac unit is told that one is scheduled for implantation of an automatic internal cardioverter defibrillator. Which of the following patients is most likely to have this procedure? A patient admitted for myocardial infarction without cardiac muscle damage, a post-operative coronary bypass patient recovering on schedule, a patient with a history of ventricular tachycardia and syncope episodes, or is it D, a patient with a history of atrial tachycardia and fatigue? We got C. Okay, all right. We got C's. All right. C. Rob RN says C. Okay. Kaylin says C. Wifey says C. All right. I'm going to give you about another 15 seconds. Everybody's kind of knocking this one out of the park. Hey, if you guys are just joining, my name is Kevin. We're doing nursing style questions. So make sure you guys like, share, follow. Hey, I want to know who you are. If you're new here, I want to know who you are, where you're from, and where you're at in your nursing journey. You're a brand new nurse. You know, are you a prerequisite nurse? Are you in nursing school? Did you just now start nursing school? Hey, do you want to quit because your first semester is really like whooping that ass? You know what I'm saying? So let me know. Because I'm telling you, that first semester, tear that ass up. All right, here we go. Answer in 3, 2. And the answer is C, a patient with a history of ventricular tachycardia and syncopal episodes. First semester, junior year. Okay, shout out to you. Yes, sir. An autonomic internal cardioverter defibrillator delivers an electric shock to the heart to terminate episodes of ventricular tachycardia and ventricular fibrillation. This is necessary for a patient with significant ventricular symptoms such as tachycardia resulting in syncope, right? Hey, ventricular tachycardia can lead to VFib, right? Or you could have, a pulseless VTAC, right? That's what we call it, pulseless VTAC. Currently pre-nursing, start LVN or LPN in January. Shout out to you. Is it Buck Baby? I was about to say Buck Nasty, but I'm sorry. Forgive me. My name is Lydia from Ohio. Okay. So shout out to Preparing for NCLEX. Shout out to you, Lydia. I'm an LPN school. I have 3 more months till I graduate. Shout out to you, Christine. I was confused because I looked for postless. Taryn, where are you? See, I just brought up postless VTAC. You over there looking for postless VTAC. See, don't be reading into it. Jessica said, are you in the military as a nurse? I'm looking at joining after I graduate. No, I am not in the military as a nurse. I am enlisted as a enlisted man in the Navy. And I am not a nurse. I work as a nurse as a civilian. So, however, I know a lot about how to become a nurse in the Navy. And I have a lot of Navy friends that are nurses too. So a patient is scheduled for an MRI scan for suspected lung cancer. Which of the following is a contraindication to the study for this patient? So again, what is bad for this patient if they do that? A patient it has a shellfish allergy, patient has a pacemaker, patient is claustrophobic, or the patient is taking antipsychotic medications. Have you thought about being a nurse in the Navy? Very much so. Very much so. But I've been in the Navy for 16 years, so it doesn't matter too much to me anymore. Where's Cass? They looking for you. They looking for you. They looking for your guidance, girl. Where you at, ma'am? Give it to them. All right, I'm gonna give you all about 10 more seconds. I was the second one to say. Oh, okay. LPN for 7 years, just graduated with RN degree last month. Shout out to you, Miss Diva. Man, I've been doing these lives with you, and I feel the best knowing I have. Hey, I got you. This is what I'm here for. That's the type of stuff that I like to hear. Like, it makes me feel good because I know it's working for somebody. All right, here we go. In 3, 2, and the answer is B. The patient has a pacemaker. The implanted pacemaker will interfere with the magnetic field of the MRI scanner and may be deactivated by them. Patients with cardiac implantable devices are at risk for inappropriate device therapy. Or the device heating or moving or arrhythmias during the MRI. These patients must be scheduled in a CIED blocked slot or scheduled for an electrophysiological nurse or tech support. But nowadays MRIs, conditional. They have those widely available. I don't even feel like reading all that now. So I was actually more like focused on y'all's question. My dad, who was a surface warfare officer, definitely trying Navy or either Air Force. Well, that would be my best thought. I mean, all branches of service have their own. They all have their own perks. You know, I'm a Navy guy. Like I said, I've been in the Navy for 16 years, and I'm real biased. So there's that. But hey, anybody wanting to be a nurse, specifically an RN who has their bachelor's degree, military is definitely it's a good thing to do if you decide you want to go that route. All right, here we go. Question number 18. A nurse calls a physician with the concern that a patient has developed a pulmonary embolism. Which of the following symptoms has the nurse most likely observed? A patient is somnolent and decreased response to the family. The patient suddenly complains of chest pain and shortness of breath. Patient has developed a wet cough and the nurse hears crackles on auscultation of the lungs, or the patient has a fever, chills, and loss of appetite. We got B, had 8 of these post-COVID. Look, we ain't even going to talk about COVID because I've had so many patients that I personally was taking care of that had pulmonary embolisms due to COVID. Them D-dimers be high, baby. And I've seen so many people die from pulmonary embolisms. Like I've seen enough of that to last me like 2 lifetimes. So, and once you see it, for those that don't know and have never seen a pulmonary embolism, once you see it, you will never forget it. Hey, all my nurses that are in here, I'm pretty sure y'all can agree with me. All right. I'm gonna give y'all 10 more seconds. Shout out to all 85 of y'all rocking with me. We're doing NCLEX style / nursing questions. Make sure you guys like, share, smash that like button. Make sure you guys follow. Make sure you guys share. Don't be greedy out here. Share the love. I'm scared to see that real life situation. Well, hey, it comes with the territory. Especially if you work in the ICU, because that's where I worked at when I saw them all. All right, so the answer is B. The patient suddenly complains of chest pain and shortness of breath. Typical symptoms of pulmonary embolism include, but not limited to, chest pain, shortness of breath, and severe anxiety. And let me tell you right now, they 100% will have both of them. The physician should be notified immediately. Clinical signs and symptoms for pulmonary embolism are nonspecific. Therefore, patients suspected of having a pulmonary embolism because of unexplained dyspnea, tachypnea, or chest pain, or the presence of risk factors for pulmonary embolism must undergo diagnostic test until the diagnosis is ascertained or eliminated, or an alternative diagnosis is confirmed. I headed to my fourth quarter of nursing school, shocked that I'm answering these well. Why are you shocked? You in school. You should be answering these right. Kayla, what you mean? Girl, you better stop playing. Appreciate everybody smashing that like button. Make sure you guys follow. Hey, if you guys are new here, make sure you guys follow. I want to know who you are, where you're at in your nursing journey. That's the type of stuff that I want to know. I'm scared. Yeah, I'm trying to tell you, if you are going to be a floor nurse, I can guarantee you at one time in your career, you are going to see somebody throw a PE. Brandon, what's up? Is this for LPN or RN? It's for both. A patient comes to the emergency department with abdominal pain. So paint the picture. Workup reveals the presence of a rapidly enlarging abdominal aortic aneurysm. Which of the following actions should the nurse expect? The patient will be admitted to the medicine unit for observation and medication. The patient will be admitted to a day surgery unit for sclerotherapy. The patient will be admitted to a surgical unit and resection will be scheduled. The patient will be discharged home to follow up with his cardiologist in 24 hours. Oh my God. I'm sorry, y'all. I was over here sneezing, losing my mind. Everybody's saying C. Okay, we got C's. Who is that? Jen says C. Angela says C. Kirsten says C. Sierra says C. Is it Shondell says C. Brandon says C. Laura says C. All right, cool. All right, everybody's telling me C. Okay. It's going to be wild if you ever see an abdominal aortic aneurysm. Them shits are not fun. I'm just being all the way real. All right, here we go. Here's our answer in 3, 2. And the answer is C. The patient will be admitted to the surgical unit and resection will be scheduled. A rapidly enlarging abdominal aortic aneurysm, or a AAA as you hear it called, is a significant risk of rupture and should be resected as soon as possible. No other appropriate treatment options currently exist. Ask Graph. Yep. There you go. Let's go. Risk for hemorrhaging. Yeah, most definitely. I can tell. And that ain't no risk for hemorrhaging. They already hemorrhaging. I'm just letting you know. They hemorrhaging and they filling that gut up. They're filling it up. All right. And then if you guys are interested to know what part of the NCLEX pie that it came from one of the 8, the reduction of risk potential, right? All right. Risk for death. Yeah, definitely. Knocking on death's door at that point. All right, here we go. Question number 20. A patient with leukemia is receiving chemotherapy that is known to depress bone marrow. A CBC reveals a platelet count of 25. You'll see it like 25 or 25,000, right? So paint the picture for the CBC of a platelet count of 25. Know what the normal is, right? Which of the following actions related specifically to the platelet count should be included in the nursing care plan? I want to monitor for fever every 4 hours. Require visitors to wear respirator masks and protective clothing. Consider transfusion of packed red blood cells. Or check for signs and symptoms of bleeding, including, examination of urine and stool for blood. All right, cool. We got D. You got D, assess. Okay. Is it Rob? I'm about to call you Rod, but Rob says D. Okay. Had this one on my farm test today. Shout out to you, Kenny. All right, Ken Dog. Did you get it right? I hope you got it right. All right, cool. Love it. And we're flying through it. Yay, that's what I'm talking about. Hey, guys, why not C? Let's find out. We're going to find out when we read that rationale. Add pi, right? So there are those times where you can implement before you assess. But this is not one of those times, right? We need more, we want to assess. We need more information, right? Think here. Yeah, I got you. Here we go. Here's our answer in 3, 2. The answer is D. We want to check for signs of bleeding, including examination of urine and stool for blood. The platelet count at 25 is severely thrombocytopenic and should prompt the initiation of bleeding precautions to including monitor urine and stool for evidence of bleeding. Also, if they have a low platelet count, we're also going to be thinking about like, hey, they're going to be using like electric razors. They can't use other, because now they're going to be bleeding from everywhere, right? We're going to be thinking about, if like when they're getting an IV, how they're going to be bleeding around the site, all kinds of stuff. Okay. So anytime you see a platelet count that's low, or if a patient is on antiplatelets or anticoagulants, they're also going to be high risk for bleeding. So we're also thinking about falls. So what if my man falls? He's like, oh, broke my hip. But then next, he's bleeding all over the place. And you're like, I can't stop it, right? Because obviously as a platelet count, platelets ain't platelet-ing, if that makes sense. Don't listen to me. Here we go. On to the next one. All right, hey, we're at another break. Hey, every 5 questions. I appreciate y'all. Hey, make sure you guys share. Make sure you guys like. Make sure you guys follow. All right, participation. I love the participation. It's key. Y'all are really rocking with it. I appreciate it, everybody. Hey, the more likes I get, the more questions that you get. Hey, we're already at 20, and we already been doing this for less than an hour, so we're rocking, all right? Give me all them likes. Don't troll my chat. You already know the deal. If you guys want to know where I got these questions from, go check them out at nurselabs.com. They're free. They're free. So go over there and check those out for yourself. They have them over there for RN and LPN as well. What time do you start each day? I usually do this Monday, Wednesday, Fridays at 5:30 Central Time. I will be doing a nursing school summit where I'm going to be specifically talking about the new generation NCLEX and all the things that you need to know in order to be prepared for it. And that's presented by TrueLearn and Picmonic. And that link is in my bio. It's free to register. So go over there and go get you some. And that way y'all can see me on Sunday at 1 o'clock, baby. Okay. All right. Hey, 7-day NCLEX course. That's my baby. I'm building that from the ground up. It's on its pre-launch phase. It's for $48. Once you have it, it is yours forever. Only for the pre-launch phase though. So make sure you guys go over there and check that out. Also, if you're looking for tutoring, one-on-one coaching, whatever you want to call it, go check it out at thebootnurse.com. I do tutoring, and I do tutoring just like this, but we go more in depth. So if that's something that you're interested in, you guys go over there and check that out. Okay. So here we go. Care plans. We're talking about care plans. Oh, care plans at nurselabs.com. Nurse Labs. Yo, Gucci out there. Gucci. I like 101. Hey, go over there and check it out. Hey, so question 21. A nurse in the emergency department is observing a 4-year-old child for signs of increased intracranial pressure after a fall from a bicycle resulting in head trauma. Which of the following signs and symptoms would be cause for concern? Is it a bulging anterior fontanelle, repeated vomiting, signs of sleepiness at 10 p.m.? I wish my son would go to sleep at 10 p.m. Or inability to read short words from a distance of 18 inches. Camille says, hey, Camille, you've been in here the whole time? Where you been at? Kayla says B. Okay. Tracy says B. Okay. Angela, A. Andrea says B. Nisi says B. Lindsay says B. I just got here. Look, you already late to the party. We already 21 questions in. Look at you. It's all right, though. You already know where it's going to be. Meningitis for Brandon. Hey, so also, if anybody ever misses a live, you guys can go check it out on my YouTube channel. The YouTube is The Boot Nurse. You can't miss it. I'm the only one. So if you want to see any of the repeats of these questions or me going over them, you guys can go over there and subscribe to my YouTube. All right, I'm going to give y'all about another 5 seconds. No, I won't. Here we go. So the answer is B, repeated vomiting. Increased pressure caused from bleeding or swelling within the skull can damage delicate brain tissue and may result in or may become life-threatening. Repeated vomiting can be an early sign of pressure as the vomiting center within the medulla is stimulated. Sorry, my son over there acting a fool. Tachycardia. Yep, you got it. Yep, you got it. Hypotension, right? But also you got to think about bleeding in the head, thinking about a stroke, right? And also if they're vomiting, they're going to go into metabolic alkalosis, right? So they're going to be having all these electrolyte issues as well. Remember, and they're kids. Kids decompensate very fast. They decompensate very fast, okay? So, all right, but shout out to y'all. Make sure y'all like. Make sure y'all smash that like button. Hey, make sure y'all share. I need y'all to be my friend, okay? I need for y'all to follow me, all right? Stop playing games. All right, here we go. A non-immunized child appears at the clinic with a visible rash, all right? Which of the following observations indicates the child may have rubella or measles? You got small blue-white spots are visible on the oral mucosa. A rash begins on the trunk and spreads outward. They have a low-grade fever, or lesions have a teardrop on a rose petal appearance? That seems very specific. Anyone need a study buddy? Hey, that's another thing I'm talking about. Hey, study with one another. Study with one another. Hey, the best way to learn is to teach it to other people. All right. Angela says B. Angela, you ever watch Rick and Morty? Every time I see your name, I want to say Smangela, Mangela. My bad. Let me stop. I watch way too much of interdimensional cable. All right. Jay Cooley says B. Rob says B. I'm gonna give y'all 10 more seconds. All right, cool. Hey, all right, cool. Hey, look, at least you know what I'm talking about. All right, here we go. Here's our answer in 3, 2. And the answer is A. Small blue-white spots are visible on the oral mucosa. Right? What is it? Koplik spots are small blue-white spots visible on the oral mucosa and are characteristic of measles infection. Near the end of the prodrome, Koplik spots appear on the buccal mucosa opposite the second molar. They generally are first seen 1 to 2 days before the appearance of the rash and last until 2 days after the rash appears. It begins to slough as the rash appears. Although this is, pathognomonic of measles, its absence does not exclude the diagnosis. All right, that's too many big words. I didn't feel like reading it. So while I definitely didn't know that. Hey, so the more that you know, right? I can tell you right now, measles was one of those diseases that was eradicated until people decided they didn't want to vaccinate their kids. So I'm just saying, don't be selfish because, you were vaccinated and you ain't got measles. Just saying. I'm just saying. Yeah, I said what I said it. Come for me if you want to. Make sure y'all follow and stop playing games. Here we go. Question 23. A child is seen in the emergency department for scarlet fever. Which of the following descriptions of scarlet fever is not correct? So which one of these has nothing to do with scarlet fever, right? Scarlet fever is caused by infection of group A streptococcus bacteria. Strawberry tongue is a characteristic sign. Petechiae occurs on the soft palate. The pharynx is red and swollen. What are we thinking? Got D, got C, got D. Angela said D. Kristen says, so hey, y'all are done. Don't answer now. Don't answer because she done already answered y'all. No clue, but I'm going with D. Oh, hey, so if y'all answer D and if y'all say that Cass is the reason y'all pick D, I'll totally understand and we'll block her from now on. I'm just playing, Cass. Cass, I'm just playing. Oh, everybody. Please, what? You want me to block you? All right, cool. Fine. I'll block you. Whatever. All right, I'm going to give y'all 10 more seconds. 10 more seconds. Rob said D. All right, here we go. In 3, 2. Oh, and the answer is C. Petechiae on the soft palate is a characteristic of rubella infection, right? Hey, we could have did like Spartacus, you know what I'm saying? Like, hey, what y'all want to do with Cass? Y'all want her to stay or y'all want her to go? You know what I'm saying? We can make it happen. Or we could, like Squid Game, put it to the test. All right, y'all. All right, hey, Angela, it's okay because guess what? Now that you know, now you can actually go and look a little bit further into it. You don't have to spend, hours doing it, but just a quick brush up on infectious diseases. It's not my strong suit. Hey, it's all right, Rob. It's okay. Hey, so here we go. Question number 24. Make sure y'all smash that like button. Time to review scarlet fever. Review it. A nurse weighing. Oh my God. If I found a nurse that weighed 30 kilos, Lord of mercy. A child weighing 30 kilos arrives at the clinic with diffuse itching as the result of an allergic reaction to an insect bite. Diphenhydramine or Benadryl 25 milligrams 3 times a day is prescribed. The correct pediatric dose is 5 milligrams per kilogram per day. Which of the following best describes the prescribed drug dose? It's the correct dose. The dose is too low. It's too high. The dose should be increased or decreased depending on the symptoms. They should let us phone a friend during the NCLEX. You know how great that would be? I would be like, let me phone the friend like at least 85 times. And by the friend, I mean Google. And Kirsten says B. Okay. Is it Andrea or Andrea? It doesn't matter. Or ask the audience. You go have an audience. Can you imagine you had an audience of people behind you while you're taking your exam? Hey, what's the answer? Not the med math. Hey, so by the way, I'm just saying, for doses calculations, type of medications, like where, of course, like fill in the blank, you'll probably get maybe 2 of those. Usually 125 milligrams is too low. Okay. I love med math. Angela, look, okay. You're something's wrong with you. Something's wrong with you. Like, why? Why do you like math? I don't even like math. I don't even like numbers. But numbers don't lie. But people do. Here's our answer. Here's our answer in 3, 2. And the answer is B. The dose is too low. Who said that? Camille, right? Camille, you said it was too low? The child's weight, 30 kilograms, and the pediatric dose of diphenhydramine is 5 milligrams per kilogram per day. So it's 5 times 30 equals 150 milligrams per day, right? Therefore, the correct dose is 150 milligrams per day. Divided into 3 doses per day, the child should receive 50 milligrams 3 times a day rather than 25 milligrams 3 times a day. Doses should not be titrated based on symptoms without counseling a physician. Dimensional analysis. Do you do med math on the floor? You do simple med math on the floor. But most of it, like if you're getting anything from pharmacy usually, pharmacy does usually all that math. However, you do have to verify, because there have been times where pharmacy has sent me some stuff that's way out of range. I remember they sent me like a 50,000 unit bag of heparin. And I'm like, what? Because, you only, like when you're giving it through like a PIC line or through a central line, it's like 5,000 units. And they sent me a bag of 50,000 units of heparin. I'm like, oh, so we just don't even like this patient no more, huh? So that's what we doing? Okay. Hey, pharmacological and parenteral therapies, y'all. All right, but most of the time, 5 rights is your best friend. No, not most of the time. It's all the time. What you mean, Cass? Don't be out here giving them false. Don't be lying to them. The 5 rights is always your best friend, all the time, every day, all the time. Here we go. Question number 25. The mother of a 2-month infant brings the child to the clinic for a well baby check. She is concerned because she feels only 1 testes in the scrotal sac. Which of the following statements about the undescended testis is the most accurate? Normally, the testes are descended by birth. The infant will likely require surgical intervention. The infant probably only has 1 testes or testis. Normally, the testicle or the testes descend by 1 year of age. Hey, what is this? I don't know what that is. What happened? Oh, there we go. Hey, who is check my private videos? What are we doing? Hey, you know what? Hold on, y'all. Hold on. Y'all keep answering. Y'all already know. Hey, y'all already know what I'm about to do. You already know. You already know what I'm finna do. There we go. There we go. Hey, Tracy, you already know what the deal was. I couldn't find the damn button. Here we go. 1,200. I did it twice. All right, here we go. Here's our answer. Hold on. All right, here we go. In 3, 2. The answer is D. Normally, the testes descend by 1 year of age. Yes, sir. Normally, the testes descend by 1 year of age. In young infants, it is common for testes to retract into the inguinal canal when the environment is cold, or wait, hold on. Somebody just tried to log on to my phone like with a Bluetooth. Like, who does that? The exam should be done in a warm room with warm hands. So don't be that nurse or that individual to touch baby with cold hands. You're mean for that. It is most likely that both testes are present and will descend by a year. If not, a full assessment will determine the appropriate treatment. That's why it's important to take these babies to these appointments, y'all. Take them to these appointments. And that is part of health promotions and maintenance. All right, here we go. Yo, hey, another break. Check me out. Hey, we're doing NCLEX questions. Make sure y'all like, make sure y'all share, make sure y'all follow. This is what we do Monday, Wednesday, Friday, 5:30, baby. Participate. Keep answering these. Give me all them likes, y'all. Give me all them likes. Don't troll my chat. You come in here telling me to find your free videos, I'm banning that ass. 600, 1200, all the above. I got these questions from nurselabs.com. Make sure you guys go over there and check that out. I'll be doing a nursing school summit presented by True Learn and Picmonic. Make sure you guys go over there and check that out, where I'm going to be talking specifically about the new generation NCLEX. Okay, and 7-day NCLEX course. That's my NCLEX course, $48. Once it's yours forever. And if you need one-on-one coaching, or if you want mentoring or tutoring or whatever, check me out at thebootnurse.com. All right, here we go. What do you think about ATI? I don't like ATI at all. Period. I don't like HESI either. Like HESI, I loathe HESI. Not a fan. So here we go. Question 26. A child is admitted to the hospital with a diagnosis of Wilms tumor stage 2. Which of the following statements most accurately describe this stage? The tumor is less than 3 centimeters in size and requires no chemotherapy. The tumor did not extend beyond the kidney and was completely resected. The tumor extended beyond the kidney but was completely resected. The tumor has spread into the abdominal cavity and cannot be resected. I just seen a video of a professor swearing by ATI. I don't like ATI. But like I said, so here's the thing, is just because the review is out there doesn't mean the review is the best for you. I didn't like UWorld. And I probably wasn't ready for it. I didn't like HESI because it didn't prepare me at all to take the NCLEX. A lot of people swear by ATI I've had a few people swear by ATI. Kirsten says B. Okay. Tracy says B. Okay. Cooley says B. All right. Appreciate all 50 of y'all rocking with me. We're doing nursing questions if you guys are new here. So make sure you guys smash that like button, share, and give me a follow. I need all the follows. So here we go. But yeah, not a big fan of ATI. In 3, 2, and the answer is C. The tumor extended beyond the kidney but was not completely resected. The staging of Wilms tumor is confirmed at surgery as follows. Stage 1, the tumor is limited to the kidney and completely resected. Stage 2, the tumor extends beyond the kidney but is completely resected. Stage 3, the residual non-homogeneous tumor is confined to the abdomen. Stage 4, homogeneous metastasis has occurred with spread beyond the abdomen. And stage 5, bilateral renal involvement is present at the diagnosis. The question didn't suggest one, that threw me. You're right, it didn't. And so that's the thing. It's just like it. So essentially, it wanted you to know more in detail about Wilms tumor. That's it. What's resect? Resect means to to dissect. I don't even know. I don't know right off the top of my head. Taryn. Go ahead and when you get finished here, or just write it down. Ask Dr. Google or Google University. Surgically remove. There you go. To remove. All right, here we go. Question number 27. Hey, we're at 27 questions. Y'all. 27 questions. A teen patient is admitted to the hospital by his physician who suspects a diagnosis of acute glomerulonephritis. Glomerulonephritis. Always a tongue twister. Why can't they just say, kidney issues? Why don't you say that? Anyways, which of the following findings is consistent with the diagnosis? Select all that apply. So you're going to have a specific gravity of 1.040, a urinary output of 350 over 24 hours. You're going to have brown urine, or you're going to have generalized edema. Got C's, got A and C. Okay. Generalized edema. Okay. A, B, C. Easy as 1, 2, 3. All right. Okay, we got A's. Tracy, you said what in B? All I see is B. Bust Down Tatiana says B. I'm sorry. I couldn't help myself. AVC. There is no V. What do you mean? No, I'm picking. Ayo. Oh, I'm sorry. I didn't mean to do that. ABC. I got you. Mrs. Stevens says A and B. Okay, cool. So I think we got a general consensus. We got B and C, A, B, and C. So let's find out what this answer is. It says, okay, still C. Okay, C, D, A, B, C. All right, here we go. In 3, 2, the answer is A, B, and C. Acute glomerulonephritis is characterized by high urine-specific gravity related to oliguria, as well as dark tea-colored urine caused by large amounts of red blood cells. There it is. There's your answer. Oh, A, the urine is dark. The specific gravity is greater than 1.02. Red blood cells or RBCs and RBCs casts are present. Functional changes include proteinuria, hematuria, reduction in GFR, and active urine sediment with RBCs and RBC casts. The decreased GFR and avid distal nephron salt and water retention result in the expansion of intravascular volume, edema, and frequently systemic hypertension. I need to RFQ. You mean RTFQ? Camille, RTFQ. But I'm picking up what you're putting down. You're right. You do need to RTFQ. Let people know what RTFQ means, Camille. Let them know. All right, here we go. Question number, because somebody's going to ask. So here we go. Question 28. Which of the following conditions most likely causes acute glomerulonephritis? Is it a congenital condition leading to renal dysfunction, prior infection of group A streptococcus within the past 10 to 14 days? Is it a viral infection of the glomeruli, or is it nephrotic syndrome? Nephrotic. All right. Terrence says B. Okay. Appreciate everybody in here rocking with me. Got 44 people up in here. Hey, if you're new here, we're doing NCLEX style questions, nursing style questions. I want to know who you are, where you're from, where you're at in your nursing journey. Angela says B. Okay. Make sure you guys like, make sure you guys share, make sure you guys follow. I need all them follows. Hey, remember, I need 10,000 people to like me and be my friend so I can stream on my computer, so I can unghetto myself. All right, let me give y'all 10 more seconds. Camille says C. Is it Arrow 140 says B? All right, Angela out here laughing. All right, cool. So here we go. Here's our answer, y'all, in 3, 2. Our answer is B. Prior infection of group A streptococcus within the past 10 to 14 days. Acute glomerulonephritis is most commonly caused by the immune response to a prior upper respiratory infection with group A streptococcus. Glomerular inflammation occurs about 10 to 14 days after the infection, resulting in scant dark urine and retention of body fluid. Periorbital edema and hypertension are common signs at diagnosis. Correct, Camille. Yeah. So essentially, somebody who had an upper respiratory infection, can develop that, and at that point, it's an acute kidney injury. Yeah. Senior second semester left, or two semesters left. Program preceptor program's preceptor process is terrible. What do you mean, user 28? Give me a little bit more context. Mrs. Stevens, I know. All right, here we go. Question 29. An infant with hydrocele is seen in the clinic for a follow-up visit at 1 month of age. The scrotum is smaller than it was at birth, but the fluid is still visible on illumination. Which of the following actions is the physician likely to recommend? Massage the groin area twice a day until the fluid is gone. Referral to a surgeon for repair. No treatment is necessary. The fluid is reabsorbing normally. Or keeping the infant in a flat supine position until the fluid is gone. So what are we thinking? I got 50 folks up in here. I need 50 answers. Make sure you guys share. Angela says A. Okay. Is it Aurora? Aurora? I don't even know. I'm just going to call you 140. Says C. JC says C. Tracy says C. Shondell says C. Okay. Appreciate everybody. We're doing nursing questions if you guys are new here. Nursing questions. I'll give you about 10 more seconds. Cass says C. Oh, it's over now. You already know the answer. Cass done gave y'all the answer, y'all. And if y'all get it wrong, it's because of her. I'll just play. Here we go. Angela, now you changing it? Come on now. Here we go. I'm an LPN, graduate with my RN in 2021. Shout out to you. Wait, Is it Alithia? Alithia. I'm gonna butcher that name. All right, here we go. And the answer is C. No treatment is necessary. The fluid is reabsorbing normally. A hydrocele is a collection of fluid in the scrotum that results from a patent tunica. Y'all hear him? Oh my God! Sorry. Illumination of the scrotum with a pocket light demonstrates the clear fluid. In most cases, the fluid reabsorbs within the first few months of life, and no treatment is necessary. My son was born with that. Was he? Well, look at that. It's crazy how many things happen to us in life that, now that you're going into into the medical field and you're going into nursing, on how relevant it is to you in your life, right? So, and hey, it happens. It goes away eventually, right? So shout out to y'all. Appreciate it. All 50 y'all rocking. Make sure y'all smash that like button. Make sure you guys share and make sure you guys follow. Here we go. Question number 30. A nurse is caring for a patient with peripheral vascular disease. The patient complains of burning and tingling in the hands and feet and cannot tolerate touch of any kind. Which of the following is the most likely explanation for these symptoms? Inadequate tissue perfusion leading to nerve damage, fluid overload leading to compression of nerve tissue, sensation distortion due to psychiatric disturbance, or inflammation of the skin on the hands and feet. Terrence says B. Okay. So think about it. They have peripheral artery disease, right? They're complaining of burning and tingling and sensation. So what is the tingling sensation in hands and feet? Like the burning sensation of tingling of hands and feet. Got A. Okay. Okay. All right. Hypoxemia? Okay. Shondell says B. Michelle says A. Okay. I'm gonna give y'all 10 more seconds. Give y'all 10 more seconds. Nisi says B. A. Inadequate circulation. Something like that. Camille, I cannot. Ma'am, I cannot with you. All right, here we go, y'all. Here's our answer in 3, 2. So the answer is A. Inadequate tissue perfusion leading to nerve damage. Patients with peripheral vascular disease often sustain nerve damage as a result of inadequate tissue perfusion. Ischemic rest pain is more worrisome. It refers to pain in the extremities that is due to a combination of PVD and inadequate perfusion. Ischemic rest pain often is exacerbated by poor cardiac output. The condition is often partially or fully revealed by placing the extremity in a dependent position so that perfusion is enhanced by the effects of gravity. So close, so close, so close. It's okay. Should have went with your gut. Always go with your gut, because 9 times out of 10, your first answer is your correct answer. Usually. Okay. All right. Let's check it out. And that, ladies and gentlemen, is a wrap. It's a wrap. That is it. There's no more questions for today. We're going to be doing questions again on Wednesday, same time, same channel. I appreciate everybody for hanging out and participating. Now we're going to do an Ask Me Anything Q&A type deal. I appreciate you guys participating. I gave one person a 600. And I don't have a problem giving nobody a 600. I am petty. You come into my chat, I'm going to ban that ass. But once again, I don't gatekeep. I got these questions off nurselabs.com. Hate them or love them, they're there for y'all, okay? And like I said, make sure you guys go to register for this nursing summit. It's going to be on October 1st. I am specifically going at 1 o'clock. So I just want to let y'all know that. 7-day NCLEX course, pre-launch phase, $48. Go over there and check that out. And if you need coaching or anything, all those links are in my link tree in my bio. So let me turn this thing around so you guys can see my glorious face. Yeah, because I know everybody's been like, oh my God, he looks like Jason Derulo. Man, that's you. That's what you sound like every time you guys say that shit to me, okay? So, what's up, y'all? How y'all doing? I'm Kevin, if you've never seen me before. I go by the Boot Nurse on all those platforms, so make sure you guys go over there and check those out. I've been a nurse for 3.5 years. I've worked in the ICU. I've worked in the OR. I failed my NCLEX 3 times. This guy. I failed my NCLEX 3 times, y'all. And that's why I say that I'm unsuccessfully successful. The summit's at 1 o'clock. Go over there and sign up for it, and you'll see all the times. And so, yeah, I love doing these questions. I wish I would have utilized social media like when I was going through school like this for this fashion, because it probably would have helped me out. You said you work in the OR. I do work in the OR. I am a scrub nurse. I was a surgical tech for 13 years. So actually, technically, I'm still a surgical tech. I still have a certification. So I can actually scrub surgical cases as well as circulate as a nurse. So, yeah, so I did that for a little bit. How did you like the ICU? I'm a surgical tech now. Shout out to you, Angela. Shout out to you. It says I started out as a corpsman in 2009. I've been a corpsman since 2007. And I'm actually a corpsman now in the reserves. I'm an HM1. I'm like the LPO of my unit, whatever. Fun. But, yeah. What was that question? How do I like the ICU? I did the ICU during the second wave of COVID. And to be honest, like, I got burnt out really fast. I got burnt out in a year. Yeah, I just got tired of it. Like, my whole thought process of what I wanted to do just wasn't there anymore. And I found my real passion in teaching. I was a surgical tech instructor for about 3.5 years. So I taught down at for all my people that are in the Navy or know anything Navy, all military medicine is here in San Antonio. And so I taught down there for about 3.5 years. So I was a surgical tech instructor, did that. I'm a master instructor as well. So I know how to make curriculums, revamp curriculums, all that kind of stuff. I actually used to teach the certification prep exam that we have for surgical tech. So this is kind of like right up my alley. And a cool surgical tech instructor too. You were my instructor. Was I? Let me see. Who is this? Yeah, that's right. I was. Wow. Small world. That's right. I was his instructor. I had to look at the picture. I was like, who the hell? Okay. Gotcha. But yeah, so what do you guys want to know? I want to know who you are, where you're from, where you're at in your nursing journey. I got about another 25 minutes before I have to get off. So I want to know what y'all got. There's 30 of y'all in here. So the biggest thing that I want for you guys to do is to like, but most importantly is to share and follow. I need 10,000 likes so I can stream on the computer. That way y'all can actually see the whole thing. I had to go eat, but I'm back. Oh, my bad, wifey. What you bring me? You ain't bring me nothing? So you selfish? Okay, I got you. First semester nursing. Angela, you first semester nursing and a surge tech? Okay, girl, I see you. Everybody want to be a surge tech. Everybody want to be a nurse. Whatever. Angela, what type of nurse do you want to be? You going to tell me you want to be an OR nurse? So, first semester. What else we got? What else y'all got? I want to be a nurse anesthetist. So you want to be a CRNA? Okay, waiting for my ATT. That'll come before you know it. I need you to tutor me. Look, hey, go ahead. Go to my link tree in my bio and go fill it out. Go fill it out. I start my LPN program on Monday. Shout out to you, Shondell. Hey, you gonna rock it. I think I want to try ICU. Go try ICU. Ain't nothing wrong with that. Remember, hey, I was a surge tech. I worked in the surgical realm my entire Navy career, with 2 deployments, and I knew everything that I needed to know in regards to being a surgical tech. And I went to the ICU, but in the end, for me, it just didn't work out. It didn't work out. I wasn't feeling it. I missed doing this where I got to teach. Third semester, Florida. I lived in Florida for a little bit. Shout out to you. October 23, graduate. Oh, so you graduate here comes soon, Taryn. Okay. I have been in the OR forever. She's like, I got to go. Yeah, I got you. I got a plate. Where you want me to send a UPS? Hey, it depends on what you got. You know what I'm saying? Kirsten said I'm in East Tennessee. BSN second quarter. Shout out to you. I live in Lake Worth, Florida. Graduated in December. Shout out to you, Nisi. Shout out to y'all. All right, cool. So now that we got that established, I obviously everybody already knows about me. So, but I live here in Texas. I specifically live in San Antonio. And yeah, it's Gucci out here. It says I'm not in school, but I was just testing my knowledge from being a unit secretary for 25 years. How do you think you did, JC, for testing out your knowledge? Psych tech, going to take LPN state board. Shout out to you, Michelle. You like Texas? I'm a Texas boy. Let me see if y'all can see it. See that? Yep. That's right. I had a big flag, but then I found out I was kind of tacky. You know what I'm saying? People don't like that. So I just got my ATT on Friday. Hey, schedule that test if you just got ATT. I want to move there. You want to move there some what? Finna be cold here. I hate Dallas. In Dallas, because Dallas is a little bit more north, obviously, because you're getting close to the Panhandle and close to the mountains. It is gonna get cold up there. But I live in San Antonio and it's hot all the time. Hot all the time. So you want to move to Texas? Hey, you can move to Texas. They like the bigger cities are pretty cool. I would not move to Austin. Like, because when I tell you Austin, there's too many, like the traffic is terrible. There's too many fucking people there. They are out of control up there. You know what I'm saying? Out of control. Out of control. So I have family in Austin. I'm going to need for you not to go live with them. I'm going to need for you to go and be an adult and go live by yourself. Okay? There. I said it. So, yeah, what else you guys got? What other questions you guys got? There's 27 of y'all in here rocking with me. So Houston, hey, H-Town is where it's at. I like H-Town. A lot of college students in Austin. There's a lot of college students everywhere. I used to live by the University of Texas in San Antonio. A lot of college students over there. You go to Houston. Houston has the largest medical center on the planet. So if you wanted to get a job, as a brand new nurse coming out of Houston, or even if you move to Houston, trust and believe me when I tell you, they're always looking for nurses out here. All right. Always looking for nurses. So let's see what else we got. Houston, a lot of colleges. Okay. So what else? What else you guys got? What else y'all got for me? I mean, I know today is Monday. I know people got the blues. People got the blues, don't want to, not saying don't want to be here, but you come get the questions and you bounce. So, let me pass my test. Pass that test. I'm trying to tell you, hey, look, I'm trying to tell you, these hospitals need y'all. What's the best time to start studying for NCLEX? Depends on where Diamond. It depends on where you are, in your nursing school journey. I wouldn't say, like, obviously, if you're not in nursing school, I wouldn't say to you, hey, you need to start studying for NCLEX. You're gonna be like, what? You're not even gonna understand. You're not going to understand the fundamentals, let alone try to understand the way that the caliber of the question on how they're asking. And that's another thing too. I'm going to give you guys a quick little synopsis. Is like the NCLEX itself has not really changed. The only thing that changed is just the way that they deliver it. But 70% of that entire exam, it's still going to be multiple choice. It's still going to be select all that apply. It's still going to be, like have the dosage calculations. It's still going to have the matching. It's still going to have all that stuff. The other 30%, we'll say 30 or 40% that they changed, it's just the way that it's delivered. So they give you the case studies. And the case studies, you get 6 questions per case study, totaling 18 questions. And those can be like quick, they could be multiple responses. They could be the bow tie. They could be the close. They could be the fill in the blank. They could be the highlight. It could be those. So it's just like the caliber of the questions, the caliber of the questions are still there. It's just how they're being delivered to you. That's it. I'm in my 3rd semester. Shout out to you, Diamond. Oh, you're in your 3rd semester. I would say you really should start heavily. How many semesters is your school, Diamond? I've been working in a hospital forever. Oh. Advice on MedSurg 2. How do I study for it? GG. I would recommend getting into a study group because I figured that out when I got to MedSurg 1. Get into a study group. And by a study group, I mean people that, that you vibe with, but not people that are a distraction. So that way, if you're in a group of, let's say it's you and 3 other people, so that's, you split all the notes up or all the chapters up 25%. You do your 25, they do theirs, so on and so forth. You put them together, boom, you have all the notes for all of MedSurg or all the notes for that specific test. Work smarter, not harder. Get the teamwork concept in right now. That way you don't feel like, you're lacking when you get down to a floor. Wifey said, I think my problem is I can't sit there that long, but I know you just have to condition yourself. What are you talking about? What you talking about, wifey? Oh, a study group is the best. Okay. Those case studies are partial credit too. Case studies are partial credit. They are. However, hold on, I take that back. There are certain questions within the case studies and throughout the entire exam that are partial credit. Like a multiple choice, it is not. It is either you get it right or you get it wrong. The fill in the blanks where they have the drop boxes, you have to get those right. You have to get both of them right to get the answer right. If you get one wrong and one right, the whole answer is wrong. Okay, so it all just depends on the question type, on which one has partial credit and which one does not. So, you have 4. I would start in your last semester. I would literally, really Diamond start studying for NCLEX. Mine's 150. Smart. There you go. Sitting there that long for the test causes my attention span to go bad. So that's why you have to practice. So everybody asks me, like, how do you get over the anxiety? You have to practice. And by that, you have to recreate the testing environment, meaning no phone, no drinks, no snacks, no cat, no dog, no kids, like, you know, and I know that's easier said than done, but you have to recreate the testing center because you can't take all those things with you. That's number one. Number two, you have to get into a rhythm of sitting there in front of the computer for an hour, you know, first 30 minutes, an hour, hour and a half, 2 hours, so on. You have to get into that rhythm. You do. And then you got to think about, are you in the right mind space? Because some people, they'll start studying and then they get distracted, or they're going through marital problems, or, you know, or their kids are acting up, or the dog shit on the carpet, or I don't know, you know, just stuff, you know, all these things you have to kind of like push all of that aside. Like I said, easier said than done. Time management is another big one. Time management is, what are you doing? What are you doing? And then also, what are you not doing? You know what I'm saying? So if you come to me, you're just like, man, I just don't get it. Okay, well, tell me about your day. You're gonna be like, oh, well, I do this. I'm like, well, shit. Well, obviously, I can tell you why you didn't pass, right? And that's what I'm telling you. That's another thing I say in my coaching. I don't coddle people. I don't coddle you. Like you sought out me, so I'm gonna give you 110%. But I'm also gonna call it like I see it. So if you tell me that, oh, I don't do this, I don't do that, I'm gonna be like, okay, well, there's your problem right there. I'm sorry. Because you want to know why? I had to get somebody checked me. Because I could tell you right now, I used to be like, man, I don't understand why I didn't pass. But then I go back and I listen. I go back and I think about it. And I'm like, well, I would come home. I would sit in front of my TV. I put it on mute. I have my phone checking Instagram. I would do one question every 5 minutes. I'd be completely distracted. I wasn't doing what I was supposed to be doing. So of course I didn't fucking pass. Of course I didn't pass. I'll call it like I see it. Straight up. I'm telling you right now, because I literally had somebody I coached who paid for my services, by the way. And I was just like, so what do you think about this? She kept saying, I guess that's the problem. I was like, there is no I guess. It's either a problem or it's not. And I'm going to tell you right now, everything is your fault. Everything is your fault, right? Even if it's not your fault, how are you going to fix it? You're going to be like, I don't know. And how are you going to fix it? And that's what I do when I coach. And that's my advice that I would give to you guys as well, is you can't make excuses. You can't make excuses. You really have to audit your time, especially with time management. Put yourself on a study schedule. Like, what is the hardest section? What is the hardest section for NCLEX for you? For me, pharmacology. Hands down, just pharmacology. So I know I had to go in, and I started with cardiac medications. And then I went down the line, and I'm just like, all right, cool. I want to learn about the ARBs. I want to learn about the statins. I want to know about, the sartans, the calcium channel blockers, the beta blockers, the diuretics, the digoxin. I needed to know all of that. And when I tell you that's where I started, that's where I started. That's where I started. So, study schedule. Do you understand NCLEX style questions? Do you understand like what they are truly asking you, right? How can you separate, the fluff? Like, are you paying more attention to the modifying phrase? And the modifying phrase is what is said at the end, because you know that if they put the word not in there, it changes the entire question, right? So it's like, are you paying more attention to the modifying phrase than the original noun? The original noun is usually the first portion where they give you all the meat and potatoes. Like, that's important. But even though I gave you all this stuff, are you answering that last bit of that question? Okay. So think about that question. Should you take a practice test first, then go over the content you didn't know, or I'm assuming, or I need to do that. Okay. Got you. So here, wifey, this is what I'll say is, yes, you want to give yourself like a baseline quiz, right? And it's going to hurt. Like, I'm telling you, when you do a baseline quiz, that shit's going to hurt. Like, you're not going to, like, you probably won't do well, right? You probably won't do well. But now that you have a baseline, now you know where you need to start so you can begin improvement, right? That's what I like to call a diagnostic test. So, you do a diagnostic or you do a baseline exam, at 150, at 85 questions, a minimum to 150 questions, whatever. And then, once you get it out, they're going to be like, okay, well, you suck at pharmacology. Well, I should start with pharm. And so if you know that pharm was the worst, management of care was second, basic care and comfort was third, physiological adaptation was fourth, then now you know that you know where to start with content while you are still doing quizzes that are randomized. And that's another thing. Anytime you do a quiz, it always needs to be random. It doesn't ever need to be by category, because your exam is never by a category. It's always random. It's a computer adaptive test. So it literally will give you different questions based off of how you answered your previous question. All right. Please bestow pharmacology knowledge, struggle with psych drugs. Oh yeah. I did that the other day and I was like, damn, I don't know nothing. Facts. It happens. It happens all the time. So I don't know yet what I bombed. What are you talking about? Oh, Sweet Misery. Did you take, I'm assuming you took your exam. Is that what you said? I don't know if you said that earlier. Isaac said, do you recommend UWorld for NGN? So all of these big NCLEX reviews all have NGN right now. Oh, your pharmacology exam. Well, you won't know you won't know until you know. So, but you already said, I think psych meds, I think you said, right? So UWorld has NGN, Archer has NGN. I'm actually working on an NGN, like big, long video, essentially like how we did right here, breaking down NCLEX questions. I'm working on a big video for my course. I've been hearing great things about Archer. Archer's great, honestly. So UWorld is good for NGN. They have pretty good questions. They don't really have content, but they have really good questions and rationales. But it really does depend on your preference. Like me, I didn't like UWorld. I used UWorld like 2 or 3 times, and I didn't like them at all. And the reason being is because I know what I was missing, and it was content. Like I needed, like, another thing you guys have to figure out for yourselves is like, what type of learner are you? Are you a visual, auditory, kinesthetic, read, write? Are you a mixture of 1, 2, or all of them? You know what I'm saying? So for me, it wasn't just about reading the question and the rationales. I needed content videos in order to fill the gap, the knowledge gap, so I could apply that to the questions that I was reading. And that's what a lot of people need. So UWorld doesn't really necessarily give you that. Archer, I think, does give you that. Remar, I believe, gives you those things too. Simple Nursing does. Mark Klimick has a review, which I thought was great. So I need something to tell me why I'm wrong. What you mean? I don't know, ma'am. You typing way too fast over there. I can't make out what you're trying to say. I appreciate I appreciate all 20 of y'all rocking with me. All right, I'm gonna hang out for another about 5-10 minutes. If you guys are new here, my name's Kevin. We're just doing a nursing, ask me anything type deal. So I want to know who you are, where you're from, where you're at in your nursing journey. So wow, nobody really mentions Remar Nursing. Yeah, Remar. No, I'm not saying. So I'm not saying I don't speak ill on her, but I know she has one of those things available. I personally didn't use her stuff to study, but I have looked over her stuff and I thought her stuff was okay. Hearst review that's out there. A lot of people swear by Hearst, but not me, because I could not get past Aunt Marlene's country accent. And I personally just didn't like the approach, but it still has the numbers to prove like, hey, they do really well at helping people pass, like definitely. So that's another one I could recommend too. I'm going to take my NCLEX on November 7th. Oh, that's a little over a month from now. Okay. Bustamante. All right. What else y'all got? What else we got? What else we got? I mean, because obviously don't nobody want to sit up here and listen to me talk the whole time. But yeah, so here's something. What was I gonna say? Yeah, so I do these reviews, I do these questions every Monday, Wednesday, and Friday. I do them every Monday, Wednesday, Friday at 5:30 Central Standard Time. And if I don't do one, I usually post something on TikTok saying like, hey, I'm not doing a TikTok today because, or, I'm hanging out with family or something came up or whatever. So just make sure you guys like, share, follow, hit that notification button so you guys know, when I'm up here running my mouth talking about NCLEX questions. So, but I think I answered everybody's questions for today. Appreciate everybody that was there during the review and essentially stayed all the way through. Like I said, if you guys definitely want to be a part of that summit, make sure you guys go over there and register. That link is in my bio, in my link tree. I will be back for questions. Hopefully, I'll be smarter than you. Good. We get smarter every day. So as you invest in yourself, like it's a slow moving process, right? You're not trying to cheat the system. You're not trying to cheat yourself. It's kind of like getting a BBL. Like you get a BBL, you cheat the system. Versus how, like, if you do squats and you go to the gym, that's an investment. You put in work every day. I'm just saying. No. So, yeah. Make sure you guys go over there and check out all those links. If you ever want to see any previous videos, when it comes to NCLEX style questions or NCLEX reviews or whatever, I put them all up on my YouTube. And that is The Boot Nurse. You'll see my glorious face there, as well as the 7-day NCLEX course. It is in its pre-launch phase. We have 36 videos up there right now of content, and new generation NCLEX videos will be up here within the next few weeks, as well as the total NCLEX review based off of the 8 sections of the NCLEX pie will also be up there. And then soon to follow will be Q banks. There'll be Q banks to go up in there. Can I use your platform to study while in nursing school? Diamond, absolutely, 100%. And not only you can use it while you're in school, you can use it. I think you said you were in an RN program, or you're an LPN program. So this program works for both RNs and LPNs, right? So it's going to be very, very content heavy. It's going to be very content heavy because I know, RN, and you said you're in your 3rd semester, and you're in your 3rd semester now. And so in your 4th semester, so you graduate in May, I'm assuming, right? Right. Okay. Yeah. So put it this way. If you get it for $48 right now, you're going to have a total of, when it's time for you to study for NCLEX, you're going to have a total of 150 content videos to look at, right? And then on top of that, I'm also going to be adding a Q bank. And then once the Q bank is there, so by the time you graduate, I'll just say you specifically, Diamond, by the time you graduate, it's going to be up and running. What area did you like the best working in the hospital? Honestly, I've been working in the hospital pretty much my entire adult life. So, when I went to the ICU, it was all right for like the first 2 hours I was there. And then I was just like, I don't ever want to be here again. Then I went to the OR, and then that was just familiar to me. So now I'm just like, okay, like whatever. Honestly, the best part about me being in the hospital, I liked working, was when I was working in infection prevention or quality control. Because I got to walk around the entire hospital, walk to the floor, interact with the nurses, interact with the patients, but them not be my patients. So the best part I honestly like that part. So I'm at the point now where I'm just kind of over the hospital. So if I was to work like anything nursing related for the hospital, it would be something like that. So, but that was a good question. All right. So I think I answered everybody's questions. Do I have any save rounds? Which department do you recommend for new nursing graduates to go into? It depends. It depends on you. It just depends on you and where you want to go, where your heart lies. Like, do you want to go to ICU? Do you want to go back to the OR, but as a different role? Do you want to go to labor and delivery? Do you want to go to oncology? Do you want to go to the tele floor? Do you want to go to the cath lab? Do you want to work in X-ray? Hell, do you even want to work in the hospital? Do you want to go work at a clinic? Do you want to do Botox, shoot lip fillers and shit in people's faces? Like, obviously I don't have that problem, but other people do. So do you want to go work there? Like the sky's the limit, but it all depends on you and where you want to go. Now, what they will tell you, and I am not a huge proponent of it because I am proof that you can do it, and there's tons of other proof, is that people will tell you to go to med-surg first. But you don't have to go to med-surg first. You don't. That's like people saying like, oh, go to med-surg before you go to the ER. No, if you want to go to the fucking ER, go. Do not pass go. Do not collect $200. Take that ass that way. And by that way, I mean to whatever department that you want to go to. However, if you are undecided and you don't know where to go, med-surg is a beautiful place for you to go, right? Because you will learn everything that you did in nursing school. You will 100% be able to apply in med-surg, from your time management to the team dynamics of, delegation as the RN, as well as, just, a medication administration, all that stuff, It says, I used to work at post-op, but I don't like med-surg. I don't like med-surg either. ER's cool. Not tag them and bag them. That sounds terrible. But what is it? Life, limb, and eyesight, stabilize them, get them out. They got to go somewhere else. 9 times the ICU, or they're going to the OR or something like that. So, but all right. I'm going to call it quits for the night. Like I said, make sure you guys go over there, check out all those websites. Last thing I'll say to y'all is be great to yourself. All right. Be great to yourself. You only got one you. All right. Remember that you can't do anything in this world for nobody else if you can't take care of you. So, also there's 14 of y'all. I better see at least 14 of y'all who have followed me. You know what I'm saying? Moosney, you already know the deal. I got you. So I will see everybody on Wednesday. All right. So hope everybody has a great rest of the couple of days and stay safe. So bye.